All right. My name is Logan O'Toole, and today I'll be going over auditory verbal therapy and its effect on increased speech intelligibility. So a little bit of background information. What is auditory verbal therapy? I got this quote from an ASHA Wire article, and it says auditory verbal therapy facilitates optimal acquisition of spoken language through listening by newborns, infants, toddlers, and young children who are deaf or hard of hearing. Auditory verbal therapy promotes early diagnosis, one-on-one therapy, and state-of-the-art audiologic management and technology. Parents and caregivers actively participate in therapy. Through guidance, coaching, and demonstration, parents become the primary facilitators of their children's spoken language development. Ultimately, parents and caregivers gain confidence that their children can have access to a full range of academic, social, and occupational choices. Auditory verbal therapy must be conducted in adherence to the principles of LSLS of auditory verbal therapy. So my client is a 4-year-old male client who was unintelligible with a severe sensorineural hearing loss and was recently fit with binaural BTE behind the ear hearing aids. Is there evidence? So my question is there evidence to support that the use of auditory verbal therapy for my 4-year-old male client who was unintelligible with a severe sensorineural hearing loss and was recently fit with binaural behind the ear hearing aids compared to no intervention in terms of increased speech intelligibility? So breaking this apart a little, my participant was the 4-year-old male client. The intervention I was targeting was auditory verbal therapy compared to no intervention at all, and the outcome I was looking for is increased speech intelligibility. So when looking for the articles that I found, I went through the academic search premiere. This is the only one that I went through, and the first time I searched auditory verbal therapy. This gave me 252 hits. Off of these articles, they were actually really good and very interesting. There was just a few things that weren't specific enough to my question. And so in the inclusion criteria, I added severe hearing loss to my original search, and the exclusion criteria is adults. This type of therapy is a very good early intervention therapy. So I did not want adults or ages beyond 20 to be a part of this search at all, or a part of articles at all. I wanted to keep it anywhere close to my client's age as possible. So I revised search terms and searched severe hearing loss and auditory verbal therapy and got 50 hits. So the first article I'll be going over is called Effects of Auditory Verbal Therapy for School-Aged Children with Hearing Loss, an Exploratory Study. So the purpose of this study was to examine auditory verbal therapy effects on speech and language outcomes in children with hearing aids and cochlear implants. The question was, will working with an SLT, so in this case, speech language therapist, that is based on listening and spoken language principles improve communication outcomes in children and young adults? Independent variables were participants' age and the speech, language, and reading assessments. Within the articles and study, the dependent variable was type of hearing loss, type of hearing device the participant used, and treatment outcomes. The participants included in the study, there was 14 ages 5 to 17 years old. Procedures, each participant was brought to the University of Auckland Listening and Language Clinic for weekly SLT sessions provided by a certified listening and spoken language specialist in auditory verbal therapy. The children were also given activities for home practice, 20 minutes per day. The overall results showed improvement in both speech perception, production, and in areas of receptive language. When appraising this article for participants, I gave it a 2, just because the age range that the participants fell under, 5 to 17 years old, that is out of my client's age range. So I just gave it a 2. They did a really good job at identifying and explaining the hearing loss and hearing device that the participants used. So I did like that. Intervention, I gave it a 2. This was the weekly SLT sessions, follow-up at home activities, the self-4, NASAT, Wyatt 2, and LNT words. Compared to, I gave it a 2. Children's age, hearing impairment, type, and significance in hearing device showed a large effect size within the treatment. And the outcome, I gave this a 2. The investigation aimed to determine whether therapy based on listening and spoken language techniques could positively affect the outcome of children diagnosed at an older age with hearing loss. So my question and the outcome of the study, they were kind of going for the same thing, but this was focusing on an older age range. So that is also why I gave the outcome a 2. So the classification level of this article, I gave a 1, and overall appraisal was a 2. Most of the sections that I was going over and appraising, they were also just suggestive. The power analysis was, I gave it a 1, because they didn't really have a power analysis, but they tried to support that with the idea that the study was a convenience sample. So the next study that I'll go over is called, is auditory verbal therapy effective for children with hearing loss? So the purpose of this study was to record speech and language outcomes from a group of children with hearing loss who participated in auditory verbal therapy. The question, will administering battery assessments to participants determine the effectiveness of AVT over a 50-month time period for a group of children with hearing loss? Independent variables: participants' age range, total language, receptive vocabulary, speech, reading, mathematics, and self-esteem pre and post test. Dependent variables found were the treatment outcomes, gender, age at identification, degree of hearing loss, onset of loss, age at CI, time spent in AVT programs, hearing device, parents' education beyond high school, and occupation category of head of household. The participants in this study, it was 2 groups of children, ages 2 to 6 years old. Procedure: the study provided parent consent, and testing was performed at the children's educational setting in a quiet room or at the child's house. Results showed that auditory verbal therapy has proved to be effective for this population of children with hearing loss. So praising this study, participants, I gave it a 3. My client does fall into this age range, so I thought that was really cool, and they also did a really good job at listing all the expectations that the client needed, and also going over the type of hearing loss and the type of hearing device that each participant had. Intervention, I gave this a 3. Participants attended one of the 5 regional centers of an AVT program in Queensland, Australia, which offers a range of service, including audiology, early intervention, and cochlear implant program. This compared to, I gave that a 3 as well. At a baseline, there was 29 children in the AVT group between 2 and 6 years old. The children were compared with a typical hearing group for initial language age, receptive vocabulary, gender, and socioeconomic status. Groups were assessed using battery assessments. I give this a 3. I thought it was really cool that they were comparing the group with hearing loss to a group with typical hearing. So I thought that was interesting. And then outcome measures, treatment outcomes, I gave this a 3. It was the treatment outcomes, gender, age at identification, degree of hearing loss, onset of loss, age at CI, time spent in AVT program, hearing device, parents educated beyond high school, and occupation category of head of household. So the classification level of this article, I gave a 3, and the overall appraisal, I gave a 2. For compelling, the validity, research integrity fell under this category. Suggestive was the evidence of research integrity, reliability of independent variable, or internal validity, the dependent variable, reliability, and external validity. And there was no power analysis within the study either, so I gave that one a 0. So the answer: is there evidence to support the use of auditory verbal therapy for my 4-year-old male client who is unintelligible with severe sensorineural hearing loss and recently was fit with binaural BTE behind the ear hearing aids compared to no intervention in terms of increased speech intelligibility? Answer is yes. There is evidence to support my PICO question. The rationale, there's currently a limited number of studies that advocate the success of auditory verbal therapy for children with sensorineural hearing loss in terms to increase speech intelligibility. Programs have been created that support studies in children under the age of 18 who have been fitted with hearing aids or cochlear implants. Many of these studies conducted include participants ages 2 to 7 years old. So for future research, there is a limited amount of precise evidence in literature on auditory verbal therapy. I think this is just because a lot of the data, it's hard to get participants, first of all, and so data is a little stretched. Many of the studies need larger participation groups and need to focus on younger age groups for those participation groups. Both of the studies had a very small participation group, and one of them was not a younger participation group. I think they had troubles with this because they were trying to specify the hearing loss degree. So this made it more difficult. And for future research, should additionally focus on receptive and expressive language skills. They did this a little in one of the studies, but if they focused on this a little more, I think there would be better outcomes and it would tell a lot more about the benefits of auditory verbal therapy. A research design I would use is a non-randomized intervention study. And that is it.